Hi, my name is Madison, and today I want to talk about how healthcare is actually a birthright. Many people in the United States do not recognize how corrupt our healthcare system is here and how little it actually does for the people here. Our healthcare system is supposed to follow the virtues and ideals of the American dream, but unfortunately does not follow those virtues, and it leads people thousands of dollars into debt to be able to pay for something that they needed to live. Now I want you to close your eyes for a second or imagine this actually already could be a reality for you, or it may not be. But think that you, maybe your parents, your kids, your siblings, someone very close to you got diagnosed with cancer, or they got diagnosed with another terminal illness that needs a lot of treatment. Well, if you're the person that's providing for them, you're gonna have to pay for their medical bills, their medication, doctor visits, radiation, chemo. And on top of that, you're gonna have to be able to put food on the table for yourself. And if you have kids that you need to provide for, put food on the table for them. You're gonna have to pay for your house, your car, your bills. And it leads you hundreds of thousands of dollars into debt. A debt that most people cannot get out of in their lifetime. Just to be able to put food on the table and to provide treatment for someone that they need to live. Now, many people might think, well, why not just get insurance? Because insurance lowers prices, it makes things more affordable, it's there, why don't we use it? Well, according to the National Institute of Health, having insurance is no assurance of appropriate care. And according to the government AEI studies, it actually shows that insurance does very little when it comes to healthcare, because most insurances come from people's employers, but if they're sick or if they're caring for someone that's sick, they're most likely going to lose their job because they can't go to work. Therefore, they're not going to have insurance. Or other insurances that are out of work and that people can get without having to get it through their employer. Those insurances most likely do not cover chemos, radiations, or certain types of medication needed by people that are sick. Now, out of a study done by the Commonwealth Fund with the countries of Switzerland, Norway, France, Australia, Sweden, Canada, New Zealand, Germany, Netherlands, United Kingdom, and us, it actually shows that the United States has the lowest life expectancy out of these countries, even though we pay the most for healthcare. We are sitting at around a 78-year-olds for life expectancy instead of around 82 or 84 like these other countries are at. And also, Americans visit the doctors less frequently and have fewer physicians than these other countries. Out of 1,000 people in the population, only 2.6 are actually doctors for the United States. And then if we look at the United States has the highest rate of avoidable deaths. So based off of a survey done in 2016, the deaths per 100,000 population, the United States was at 112 compared to the second highest, which was 86 by Germany. Now, so what can be done to increase life expectancy, increase our doctor visits, increase the amount of doctors we have while making healthcare affordable? Well, right now, because of the large mortality gap between our country and other countries, the National Institute of Health, the National Research Council, and the Institute of Medicine are conducting a study of the following countries of Switzerland, the Netherlands, and Canada's healthcare system of universal coverage, where they treat healthcare as a birthright, to see what can be done and changed in the United States to increase our life expectancy and lower treatment costs. First, they have recognized that it is an issue, and other Americans need to recognize that it is an issue, and then we need to challenge the American dream in order to sign petitions and show the government that the healthcare we're getting is not fair and is not right. And it's not right to put someone hundreds of thousands of dollars into debt just to get treatment that they needed to survive. Our lives shouldn't be based off of money. It should be based off of being able to live.